I'm going to be starting with obesity. The definition of obesity. Obesity is a condition that is characterized by excessive weight, and it has significant implications for health. The obesity is classified into three. First of all, there is overweight, being overweight, which is measured by a concept called BMI, which is the body mass index. Body mass index is calculated by the weight in kilograms divided by the height in meters squared. So weight in kilograms divided by the height in meters squared. For example, if you weigh 90 kilograms and your height is 1.7 meters, your BMI will be 90 over 1.7 squared, 1.7 times 1.7. So that would be determining your BMI. Anybody with a BMI of 25 and above is overweight. Anybody with a BMI of 30 to 35 is obese, but is class 1 obesity. Anybody with a BMI of 35 to 39.9 is class 2 obesity, and anybody with a BMI of over 40 is class 3, which is classified as severe obesity. Obesity sometimes can also be measured by what we call the weight circumference. The weight circumference is when you measure your weight. For example, for men, it's our trouser width or trouser size. Some is 38, some is 40. And most people who have a BMI between 25 and 35, that is, they are overweight up to the limit of class 1 obesity. You can also use the weight circumference as a measure. Any man with a weight circumference above 40 inches will be classified as obese. 40 inches equates to 102 cm. Obesity facts are as follows. Obesity is a chronic disease. Is linked to a condition called metabolic syndrome. Now, metabolic syndrome has 5 components, and 3 of those components are the topics we're dealing with today. So high sugar or diabetes, blood pressure or hypertension, high blood pressure or hypertension, obesity itself, especially truncal obesity, and then triglycerides, raised triglycerides and low HDL. Now, triglycerides or cholesterol generally are divided into several types of cholesterol. Now, when somebody is obese, the physical manifestation is the weight as a measure of the height, which is the BMI that I've talked about earlier on. But there is also a blood component of obesity called cholesterol. So we can measure the level of cholesterol in the blood, and it will give us an idea of the link with obesity. How much obese somebody is sometimes can be portrayed in the level of the cholesterol in the blood. So there is good cholesterol, there is bad cholesterol. Good cholesterol is high density lipoprotein, HDL, and that is one that protects against the heart. The bad cholesterol is LDL or very low LDL. LDL or very low LDL, low density lipoprotein or very low density lipoprotein. That's the bad cholesterol. And there is also cholesterol that is not reflected by the cholesterol in the blood, but that reflects the cholesterol or fat in the tissues, and that is triglycerides. So the 5 components of metabolic syndrome are 1, high blood sugar or diabetes, high blood pressure or hypertension, and truncal obesity, obesity around the waist, basically, as well as the blood measurements of triglycerides and cholesterol. Now, the HDL is the good cholesterol. So if the HDL is low, then it's better for you. But triglycerides is the bad cholesterol, bad fat, as well as bad cholesterol. So triglycerides is a measure of the cholesterol in the body, around the organs. So generally, obesity is responsible for more than 230 conditions that it can cause, and that's why it's very dangerous. And it's also a global epidemic. It's a global epidemic. Cases of obesity are rising every year. For example, in 2015, 2016, statistics done in the US, prevalence of obesity in the men is 37.9%. 37.9% in the US. And it's predicted that this amount by the year 2030, which is only 10 years away, it will be almost 50. Some of the things I said this morning, I'm saying today, is from the research done by Lee and Perrault, which is found in online, and armed obesity in adults, prevalence, screening, and evaluation. So what are the complications and comorbidities? When we say comorbidities, we're talking about other disease conditions that can occur with diabetes, or that diabetes can cause and predispose to, or together with diabetes can cause more severe outcomes like heart attack, stroke, and death. So those are the worst case scenarios: heart attack, stroke, and death. And that will not be a portion in Jesus' name. But there are several other complications that obesity can cause: metabolic outcomes or metabolic conditions like type 2 diabetes, hypertension, hyperlipidemia, ischemic heart disease, heart failure, atrial fibrillation, and stroke, like I said. Also, several cancers have been linked to obesity: esophageal cancer, gastric cancer, pancreatic, colon, and anorectal cancer. There are also systemic conditions like respiratory conditions like sleep apnea, snoring, and sleep apnea that is related to obesity, gastroesophageal reflux disease or acid reflux, incontinence, infertility in women, polycystic ovarian syndrome in women, chronic kidney disease, skin conditions like acanthosis nigricans, which is common in Black people, osteoarthritis, and other musculoskeletal conditions, as well as central nervous system problems like sleep disorders, and so on and so forth. There are also psychological problems that obesity can cause, like stress, stigma, depression, and anxiety, as well as thromboembolism, which is clots in the heart or in the lungs.